In the realm of modern medicine, a groundbreaking understanding has emerged that challenges conventional approaches to skin health. For decades, dermatological conditions have been treated primarily through topical solutions, prescription medications, and cosmetic interventions. However, recent scientific discoveries have illuminated a profound connection between the body's largest organ, the skin, and its most complex system, the digestive tract. This revelation suggests that many persistent skin issues may stem not from external factors but from internal imbalances within the gastrointestinal system. The implications of this discovery are far-reaching, offering new hope for individuals struggling with chronic skin conditions that have resisted traditional treatments. The human gut, often referred to as the second brain, houses trillions of microorganisms that form a delicate ecosystem crucial to overall health. This microbiome, when functioning optimally, maintains a harmonious balance between beneficial and potentially harmful bacteria. However, various factors such as dietary choices, medication use, and lifestyle habits can disrupt this equilibrium, leading to what is known as dysbiosis. This microbial imbalance triggers a cascade of physiological responses that extend far beyond digestive symptoms, manifesting visibly on the skin's surface. Understanding this intricate relationship requires delving deeper into the mechanisms by which gut health influences skin condition, revealing a complex network of biological interactions that connect these seemingly distant systems. At the core of gut-skin interaction lies the delicate balance of the gut microbiome, where an overabundance of harmful bacteria relative to beneficial strains creates a state of dysbiosis. This imbalance frequently stems from modern dietary patterns rich in processed foods and low in fiber, coupled with the widespread use of antibiotics that indiscriminately eliminate both beneficial and pathogenic microorganisms. The consequences of this disruption extend beyond mere digestive discomfort, initiating a systemic inflammatory response that manifests prominently on facial skin. One of the most notable skin conditions associated with altered gut microbiota is rosacea, characterized by persistent redness and visible blood vessels across the cheeks and nose. Medical practitioners' tendency to prescribe antibiotics for rosacea treatment, while providing temporary relief, often exacerbates the underlying issue by further depleting beneficial gut bacteria. The inflammatory cascade triggered by microbiome imbalance doesn't remain confined to the digestive tract. Instead, it permeates throughout the body's systems, affecting distant organs including the skin. This systemic inflammation manifests particularly in facial regions due to the unique vascular network connecting the gut to facial tissues. As inflammatory mediators circulate through the bloodstream, they accumulate in facial capillaries, leading to the characteristic flushing and persistent erythema observed in rosacea patients. Moreover, the cyclical nature of this condition becomes evident when antibiotic treatments, while reducing immediate symptoms, ultimately worsen the underlying dysbiosis, setting the stage for more severe future outbreaks. This paradox highlights the necessity of addressing the root cause rather than merely suppressing symptoms, emphasizing the importance of restoring microbial balance through comprehensive gut health strategies. Another significant contributor to skin health deterioration emerges from small intestinal bacterial overgrowth, SIBO, a condition where excessive bacteria colonize the small intestine rather than remaining predominantly in the large intestine. This displacement creates a hostile environment for proper digestion and nutrient absorption, as the misplaced microbes aggressively compete with the host for essential nutrients. The resulting nutritional deficiencies manifest prominently through various dermatological symptoms, ranging from subtle skin texture changes to more severe inflammatory conditions. Particularly concerning is the impact on fat-soluble vitamin absorption, including vitamins A, D, E, and K, which play crucial roles in maintaining skin integrity and immune function. The inflammatory response triggered by SIBO extends beyond mere nutrient competition, as the displaced bacteria produce metabolites that irritate the intestinal lining and trigger systemic immune reactions. This chronic inflammation often presents as joint pain and arthritis-like symptoms alongside skin manifestations, creating a complex web of interconnected health issues. The small intestine's compromised ability to absorb essential nutrients leads to specific skin conditions, with rosacea again appearing as a common manifestation. The connection between SIBO and rosacea is particularly noteworthy, as both conditions share underlying inflammatory pathways and respond similarly to treatments targeting bacterial overgrowth. Additionally, the malabsorption of key nutrients such as zinc and omega-3 fatty acids contributes to dry, flaky skin and impaired wound healing, further illustrating how SIBO's effects ripple outward to affect overall skin health. Chronic inflammation within the gastrointestinal tract represents another critical factor influencing skin health, with dietary components playing a pivotal role in triggering and perpetuating this inflammatory cascade. Among the most common culprits is gluten, a protein found in wheat and related grains, which can provoke an immune response in susceptible individuals. This reaction damages the intestinal lining, creating microscopic openings that allow undigested food particles and toxins to enter the bloodstream, a condition known as increased intestinal permeability or leaky gut. The resulting systemic inflammation manifests notably through various skin conditions, with particular emphasis on nutrient absorption challenges that directly affect skin health. One of the most significant consequences of gut inflammation is the impaired absorption of zinc, an essential mineral crucial for maintaining healthy skin structure and function. When inflammation compromises the intestinal lining, zinc uptake decreases substantially, leading to characteristic skin manifestations such as rashes and a distinctive pattern of flaky, scaly patches around the nose and mouth. This deficiency not only affects skin texture but also impairs the body's natural healing processes, making individuals more susceptible to wounds, ulcers, and other dermatological complications. The relationship between zinc absorption and gut health demonstrates how treating surface-level symptoms without addressing underlying inflammation remains ineffective in achieving long-term skin improvement. The severity of digestive dysfunction directly correlates with the complexity of dietary management required for optimal skin health. Individuals with compromised digestive systems often benefit from simplified meal compositions, limiting the variety of foods consumed at each sitting to reduce the burden on their digestive tract. This approach aligns with the principles of the carnivore diet, which has gained recognition for its effectiveness in managing various autoimmune and skin conditions. By eliminating potential dietary irritants and focusing on easily digestible animal products, this dietary strategy reduces the inflammatory load on the gut, allowing for gradual healing of the intestinal lining and improved nutrient absorption. The success of such approaches underscores the fundamental connection between dietary choices, gut health, and skin condition, highlighting the necessity of addressing digestive inflammation as a primary strategy in skin health management. As chronic gut inflammation persists, it initiates a progressive degeneration of the intestinal villi, the finger-like projections lining the small intestine that significantly increase the surface area available for nutrient absorption. This structural damage severely compromises the body's ability to extract essential vitamins and minerals from food, with vitamin D deficiency emerging as a particularly concerning consequence. The implications of reduced vitamin D absorption extend far beyond general health, directly impacting skin condition through multiple pathways. Vitamin D plays a crucial role in regulating immune function, and its deficiency leaves the skin vulnerable to various autoimmune disorders, including psoriasis, eczema, and vitiligo. These conditions arise when the immune system mistakenly attacks healthy skin cells, leading to chronic inflammation and tissue damage. The connection between vitamin D levels and skin health becomes even more pronounced when considering the hormone's role in modulating skin cell growth and differentiation. Without adequate vitamin D, skin cells may proliferate abnormally, contributing to thickened, scaly patches characteristic of several autoimmune skin diseases. Furthermore, vitamin D deficiency weakens the skin's barrier function, making it more susceptible to infections and environmental damage. The challenge of correcting this deficiency becomes apparent when oral supplementation proves insufficient due to compromised gut absorption. Innovative approaches, such as high-dose vitamin D therapy combined with enhanced delivery methods, become necessary to penetrate the damaged intestinal lining and restore adequate levels. Natural sunlight exposure and targeted light therapy emerge as complementary strategies to address vitamin D deficiency, bypassing the compromised digestive system entirely. Ultraviolet B radiation triggers vitamin D synthesis directly in the skin, providing an alternative pathway for maintaining adequate levels. This approach not only helps correct existing deficiencies but also supports ongoing skin health maintenance. The effectiveness of these strategies underscores the complex interplay between gut health, nutrient absorption, and skin condition, reinforcing the necessity of addressing villi degeneration and vitamin D deficiency as integral components of comprehensive skin health management. The gallbladder's critical role in digestive health extends significantly to skin condition through its influence on bile production and fat-soluble vitamin absorption. When bile production becomes insufficient, whether due to gallbladder removal or functional impairment, the body's ability to emulsify and absorb fats dramatically decreases. This deficiency particularly affects the absorption of fat-soluble vitamins A, D, E, and K, each playing vital roles in maintaining healthy skin structure and function. Vitamin A deficiency, in particular, manifests distinctly through the development of keratosis pilaris, commonly known as chicken skin, characterized by small, rough bumps on the upper arms and thighs. These raised follicles occur when hair follicles become clogged with keratin, a condition directly linked to inadequate vitamin A levels. Addressing bile insufficiency requires targeted nutritional interventions that focus on increasing active vitamin A intake through retinol-rich sources. Beef liver stands out as an exceptionally potent source, containing highly bioavailable retinol along with other essential nutrients. Cod liver oil offers another effective solution, combining high concentrations of vitamin A with omega-3 fatty acids that provide additional benefits for skin health. Interestingly, the omega-3 content in cod liver oil works synergistically with vitamin A to improve skin texture and reduce inflammation, offering a comprehensive approach to managing keratosis pilaris and related conditions. For individuals who cannot meet their needs through dietary sources alone, bile supplementation becomes necessary. Ox bile supplements and purified bile salts help compensate for inadequate bile production, facilitating proper fat digestion and subsequent nutrient absorption. The impact of estrogen therapies and high carbohydrate consumption on bile production adds another layer of complexity to this relationship. Hormonal treatments, including birth control pills and hormone replacement therapy, can interfere with bile flow, while elevated insulin levels from excessive carbohydrate intake may deplete bile stores. This dual challenge necessitates a holistic approach to managing bile sufficiency, incorporating dietary modifications alongside targeted supplementation. The successful integration of these strategies not only addresses immediate skin concerns but also supports long-term digestive health, demonstrating the intricate connection between bile function, nutrient absorption, and skin condition. The journey toward optimal skin health through gut restoration demands a multifaceted approach that integrates dietary modifications, probiotic supplementation, and strategic fasting protocols. The carnivore diet emerges as a particularly effective intervention for individuals with severely compromised gut health, offering a systematic elimination of potential dietary irritants while providing essential nutrients in their most bioavailable forms. This dietary strategy, though initially restrictive, proves remarkably successful in resolving both autoimmune conditions and persistent skin issues by removing inflammatory triggers and supporting gut healing. The high glutamine content found in animal proteins plays a crucial role in this process, promoting regeneration of the intestinal lining and reducing systemic inflammation that manifests on the skin. Probiotic interventions take center stage in restoring microbial balance, with certain strains demonstrating remarkable efficacy in addressing small intestinal bacterial overgrowth and related skin conditions. Aleuteride, a versatile probiotic strain capable of colonizing both the small and large intestines, creates an acidic environment inhospitable to pathogenic bacteria while supporting digestive health. This targeted approach to probiotic supplementation yields significant improvements in acne and other inflammatory skin conditions by addressing the root cause of systemic inflammation. Complementing these efforts, intermittent fasting protocols offer additional benefits by giving the digestive system necessary rest periods, allowing for natural cleansing processes and reduction of bacterial overgrowth. The integration of these strategies requires careful consideration of individual needs and responses. While some individuals may benefit from aggressive dietary restrictions initially, others might achieve similar results through more moderate approaches. The inclusion of naturally fermented foods such as sauerkraut, kimchi, and yogurt provides additional support for microbial balance, offering diverse strains of beneficial bacteria that complement targeted supplementation. Acidifying agents like betaine hydrochloride and apple cider vinegar further enhance digestive function, particularly valuable for individuals experiencing reduced stomach acid production. Together, these comprehensive interventions create a supportive environment for gut healing, leading to sustained improvements in skin health that address both immediate symptoms and underlying causes. The intricate relationship between gut health and skin condition represents a fundamental shift in our understanding of dermatological wellness. Rather than viewing skin issues as isolated problems requiring topical solutions, this comprehensive perspective reveals them as external manifestations of internal imbalances. The evidence presented demonstrates that persistent skin conditions often serve as warning signals from the body, indicating deeper issues within the digestive system that demand attention. By recognizing these connections, individuals gain the opportunity to address the root causes of their skin concerns rather than merely masking symptoms. This new understanding carries significant implications for both personal health management and medical practice. It suggests that traditional approaches focusing solely on external treatments may need reevaluation in light of the powerful influence gut health exerts on skin condition. The success of dietary interventions, probiotic supplementation, and targeted nutritional strategies in resolving chronic skin issues underscores the necessity of adopting a holistic approach to skin health. As research continues to illuminate the complex interactions between the gut microbiome and skin physiology, healthcare providers, and individuals alike must consider these findings when developing treatment plans for persistent dermatological conditions. In wrapping up this deep dive into the skin-gut connection, it's clear that achieving radiant, healthy skin goes far beyond surface-level treatments. The evidence is undeniable. Your skin is a mirror reflecting the state of your digestive health, and addressing gut imbalances can transform not only your complexion but your overall well-being. Whether it's through dietary adjustments, targeted supplementation, or lifestyle changes, the power to heal lies within your hands and your gut. So, if you've been struggling with persistent skin issues, it's time to shift your focus inward. Start by nurturing your digestive system, because when you heal your gut, you don't just clear up your skin, you unlock a healthier, more vibrant version of yourself. Thanks for joining me on this journey to uncover the root causes of skin health. Don't forget to like, subscribe, and share this video with anyone who might benefit from understanding the incredible link between gut and skin. Thanks for watching.